I had a few minutes more because I'm early today. It was only 5:30 when I started recording these couple videos, so I'm going to dwell more into the ADN aspect. That's an associate's degree of nursing for those completely starting out new and not knowing the nomenclature. That's another thing. I'll go into that. Nomenclatures, acronyms, and stuff like that. I'll go into that in another video. I'll put that in a thing. But ADNs, associate's degree programs, and there's diploma. There are still diploma degree programs, and quote unquote, that's the lowest rung. I don't like that. I actually think diploma program nurses, from what I've seen in my experience, are the best prepared for clinical settings. So the BSNs, I mean, I'm sure there's exceptions, don't get me wrong, there's exceptions. But by and large, on average, I think the diploma people are better prepared because they're right in day one, they're in the hospital. They're in the clinical settings. They are in the shits to start with. Whereas ADNs and BSNs, I mean, I know programs that take a year before they're even touching the patient. And I'm like, what? I was lucky my ADN program would go right into it. The thing is, to get into an ADN program, everybody says, oh, it's just 2 years. No, you need to prepare. You need to have prereqs. It's just like not like med school, but I was pre-med back in the day. And you had to have all your BS courses, which I like to think of as weed out courses. Your bios, your APs, your microbios, psych, all that crap. No offense. You need some of it. And just for a background wise, yes, you do need some anatomy, physiology, and all, etc. But that takes like 2 years to finish. Especially for me, I came from a BA in liberal arts. So unless you're a bio major, microbiome major, or something like that, where you're already pretty much prepared, you need at least a year. And it took me a year and a half because I took my time because I was working full time and going to school to slowly gather that up. I was lucky. Some courses, liberal arts wise, were taken care of. All my BA at least took care of all that. So I just needed to do the hardcore sciences. But you need that. And that makes the 2-year program at least 3 years. I've not seen it happen under that. Even a friend of mine who, she went into it right from high school. She ate up all her prereqs in high school, which is great for her. So she entered the program 18 years old because during high school, she commuted to the college and took college level courses. So no matter what anyone says, 2-year program, it's not 2 years. It's at least 3 years. But is it easier? Is it cheaper? Is it that, all that versus BSN? Yes, it is cheaper. And I'll say it, I don't care. It's easier than the BSN program. It is, because I came from a very prestigious 4-year program, college-wise. No comparison. But part of that is because they realized a lot of us were a little older. Not all of us. Our average age was still 21, 22. And I was 48. So, I brought up probably without me and a couple other people, it was probably like 19. But still higher than a college course in typical college cohort, it would have been 18 or, 17 and a half or something like that, right? So, but ADN is the easier way, that's the pro. It's cheaper. That's a big pro, but you are prepared for the field. Okay.